Belinda's going to let them into the room, so it's all good. I would just like to start by introducing myself and the other student facilitators here today. My name's Laura. We've also got Kayla and Nasunki. We're all final year master's students at La Trobe. And there's some familiar names in here as well, which is really good to see. Just before we begin, we need to do an acknowledgement of country, so I'll just do that one now. La Trobe University acknowledges that this event and our participants are located on the lands of many traditional custodians in Australia. We recognise their ongoing connection to the land and the value their unique contribution to the university and wider Australian society. We pay our respects to Indigenous elders, past, present and emerging, and extend this respect to any Indigenous participants joining us online today over Zoom. So everyone, please feel free to ask any questions you have in the chat or save them for the end. If you feel like you can say them out loud, that's good as well. And there will definitely be time to go through them. We've got some general questions to begin with, and then we'll get on to everyone's questions afterwards. So we'd like to give a warm welcome to the panellists we've got today. And we'll just get each of you to tell us a little bit about yourself. We might start with Elizabeth. If you'd like to tell us a little bit about who you are and your career so far.
Thanks, Laura. Hi, everyone. I'll just check you can hear me okay, first of all. Great. All right, so my name is Liz. I am also a La Trobe University graduate. So I graduated from La Trobe in 2016 and started my audiology career in 2017. I've worked at a couple different places. I started off with Hearing Australia, located in Launceston in Tasmania. And I then relocated back to Melbourne and worked with Connect Hearing. And I'm now based at Expression Australia, which is more formally known as the Victorian Deaf Society. We've had a brand change and rename over the past couple of years, but the Victorian Deaf Society. So we're a not-for-profit organisation who work with and for the deaf and hard of hearing community. So we were established in 1884 by the deaf community. And we've got a couple different departments within our organisation, but I manage the audiology team and also do a couple days clinical still there at Expression.
Beautiful, thank you. We might move on to Jacy, if you could tell us a little bit about yourself.
Hi, my name's Jacy. I currently work at Bloom Hearing Specialists and look after the clinical components, devices, the government program for our business, as well as our graduate induction program. So I'm quite heavily involved in that, as well as the recruitment and interviews. I graduated from Melbourne in, I was trying to think of it, 2006. So I started audiology in 2007 and have worked at, it was Australian Hearing then, and National Hearing Care / Amplifon. I was able to work for Amplifon in Milan for 12 months, which was an experience definitely. And in that time, I've sort of been involved in training and, as I said, recruitment across a number of different providers. So I was having a think about it, and I think I've probably done somewhere north of 600 graduate interviews in the last 5 to 6 years. So that's probably my area of strength if you had questions in that department.
Thank you, Jacy. We'll move on to Kate, if you could tell us a little bit about yourself.
Hello, everyone. My name's Kate Godfrey. I work at the Alfred Hospital, which is an acute care hospital with a fairly major trauma ward, and it's an infectious diseases hospital as well. Prior to that, I worked at Concord Hospital, which was subacute, which was much more rehab focused. And apart from that, a spattering of work with Australian Hearing many years ago, and a spattering of private practice in Singapore. So I manage the audiology unit at the Alfred. We're predominantly a balanced vestibular assessment unit, and obviously respond to ENT as well. So thank you.
Beautiful, thank you. And now we've got, I want to say this correctly, we've got Chun-Yao.
Yeah, that's
Beautiful.
good. Chun-Yao. Thanks, Laura. So yeah, my name is Chun-Yao. I'm currently working for the Hearing Health Services in Central Australia. So I also did my undergrad at La Trobe, and then I did my master's at Melbourne Uni. And then so I'm a recent graduate. I graduated 2019 at Melbourne Uni, and then I moved up here mid last year in August and did my intern. So I'm still currently doing my intern for my first year intern here. So I'm originally from Alice Springs, went to Melbourne, and I'm back again here doing my graduate intern.
Beautiful. Did Hannah make it in the end? We got Hannah? I feel like we might not.
Not yet. I'll message her and just double check.
That's all right. We'll finish off with Alicia, if you could tell us a little bit about yourself.
Hello, everyone. So most of the students would know me. I work at La Trobe University as a senior lecturer in audiology. And you all know this hat of mine, but I also have another one. I'm director of graduate research within the school. And that means that all people who are doing research degrees in the School of Allied Health, Human Services and Sport have something to do with me. So I think my role here would be to answer any questions from students who are interested in research career, academic career, or just conducting audiology research and opportunities when you graduated. I did my PhD at the University of Manchester in UK. I used to work at UQ for 7 years as a lecturer in audiology, and I was working in a number of research centers. So I'm very happy to share with you my experiences in working in research and in academia.
All right, thank you, everyone. I'll pass it over to Nasanki, and she's going to go through some questions.
Can you guys hear me all right? Okay, cool. So thank you all for sharing your experiences. It certainly sounds like you all have quite a different and interesting career path. So first, we would like to hear how you all became interested in doing something in audiology. We can start off with Elizabeth.
Yeah, so when I left school, I was working within the aged care sector. I worked at a facility called Regis Lake Park, located in Blackburn in Melbourne, and they have a deaf unit there. And a part of my role, I started learning Auslan and sign language, and I was already in my health science degree, audiology, and doing the health science degree. And that sort of confirmed it for me. I knew I wanted to do allied health, and I definitely probably wanted more of a clinical role. And I'm also probably passionate about communication, and that being sort of a strength of mine. So went into audiology, thought about speech pathology also, but landed in audiology, I think just because of the realm I was in within the aged care sector. Started learning more about people, deaf culture. And as I worked my way through my career, started learning more Auslan, and progressing sort of in the community sector of deaf and hard of hearing people, irrespective of what I was studying. And then once I graduated, sort of jumped into Hearing Australia, and just realised that I just really wanted to get back to almost sort of a community service point of view with the deaf and hard of hearing, and also to tie back in my Auslan skills that I'd been learning previously through working in the aged care facility. Yeah, so I think probably just my passion for communication and healthcare, and then having that exposure to the deaf community early on, that probably really confirmed to me that that was something that I wanted to do as my career.
It sounds really interesting how you actually got to that path from like early on. And we'll move on to Jacy next.
Yeah, I kind of fell into audiology. I was doing a science degree at Monash in Clayton, Victoria. And I was in my final year, and I'm sure anyone else that did a science degree would have got pamphlets basically saying with your major, you can do this. And audiology was one of those. And at the time I thought, says I could get a job, let's give this a go. I was always really interested in the health sort of science and physiology side. But that's, yeah, I didn't actually know it existed until that pamphlet was posted out.
There you go, interesting, another way of how people get into audio. And we'll see how Kate went into getting into audio.
Very similar story, finishing a science degree, looking around at what to do. Audiology offered a good balance between having some technical prowess and science use of your science analytical skills, as well as offering the opportunity to have a caring component with other people and combining people skills and such, which really appealed to me. So, yeah.
Thank you for that, Kate. And what about Chun-Yao? How did you get into audiology?
Very similar to everyone else here. So I did a very general health science degree at La Trobe, and also wasn't too sure what I wanted to do afterwards. So I took a gap year. I moved back home to Alice Springs with my parents, and I came to the community health centre. So currently where I'm working at, I came here. I asked if I could shadow the clinicians here. So I went with the speechies, OTs, physios, and audiologists here. So just kind of just to see a bit of taste of what everything's like. And it was the pediatric audiology here that really caught my eye. And so afterwards, I just thought I'll do my master's in audiology, wanting to do more pediatric and diagnostics audiology.
That's an interesting way to get into it as well, like shadowing some clinicians. What about Alicja?
Well, similar to Jacy, to be honest, I was, keep in mind I was living in Poland, was a happy Polish teenager at that time. And I came across again, pamphlet and advertising, and it wasn't called audiology because in continental Europe, it is slightly different. Audiologist is a medical profession. It's more like ENT and the profession which we calling here audiology, and in UK and in US, in Poland was called hearing prosthetician. It's the same degree, but it was undergraduate, 3 years degree. And so I looked at this information and I was like, okay, well, it gives you an undergraduate degree, and also it looks like you have a job straight after it. So I was really interested in it. I didn't have like bigger picture at this point, to help people and so on, but I thought it's probably an interesting job to have. And my first formal degree in actual audiology was my PhD, which was in audiology. So my undergrad was hearing prosthetics, my master's was acoustics, psychoacoustics, and then my PhD was in audiology. So long way to proper audiology title.
There you go. So I think that's about it for that question. So we'll move on to the other one. So we have, what do you guys think has been the most critical for you in terms of skills in your career so far? Anybody wants to go at it first, or?
I think somebody mentioned it before, but I think one of the biggest that I didn't think of at the time was people skills. I think there's lots of different areas of audiology, but in the area sort of adult rehab that I work in, it's really important. I mean, if you know a hearing aid inside out and back to front, you can do a fantastic audiogram. If you don't have that rapport and interaction with clients, it makes it very difficult. So I'd say that's critical.
Anybody else have anything to add to it?
And I suppose with the people skills, just to highlight that area again, it's not just with your patients, although that's the most important part. It's also with your colleagues, it's with your superiors, it's with the secretaries, it's with the people across the hall who want to use something you don't want them to use. It's all sorts of things, and how you manage all sorts of problems that come up in your day just require that pleasantry and that basic skills that sometimes can go astray in some people, and it is really the most important part of the whole process.
Yeah. Anybody else have anything to add, or?
Yeah, I think similar theme. The communication is a huge element to the adult rehab and I suppose diagnostics part of the role, being able to explain results to someone in a way that's easy for them to understand, and maybe in a gentle manner also. And yeah, just communication in general. Obviously, hearing causes a lot of communication breakdowns between significant others, partners, children, their parents, all sorts of things. So just making sure that you've got confident skills to communicate with a varied group of people, because you can see people, you know, that are, you know, 50 years older than you are when you first enter your career, people that are, you know, 10 years older than you, and just having that flexibility of being able to adapt your clinical communication skills to suit who you're talking to.
So it seems like communication and adaptability has been one of the key areas that you guys think is important. So we'll move on to the next question. I'll pass it on to Kayla.
Yeah, you guys can all hear me okay? Yeah, so this question's more for those of you who are in sort of manager or recruitment roles. So what are and it sort of follows on from the last question. So what are the skills and qualities you look for in audiology graduates? Maybe we'll start with Jacy, since you mentioned you've had a lot of experience in recruitment.
Yeah, definitely. So it's just that ability to be able to come in and hold a conversation. I have an expectation that anyone applying for a graduate role has an audiology degree, so knows how to do audiology. I'm looking for things that pulls you apart. Most years there's about 100 or so graduates, depending on WA's graduating year. So you need to find something that pulls you apart from the pack. Things like having a part-time job in customer service is one thing I always look for, because it gives you that skill and that practice of talking to strangers. So I think that's really important. A lot of companies now are also moving towards pre-recorded interviews. So have a bit of a practice in front of a mirror before you hit record, because you don't get too many chances to do it. So make sure your personality comes through on that.
Yeah, that's great advice. So does anyone else have any other qualities that they look for in audiology graduates or interns? No? That's okay. So I'll go into...
I can add something if you wanted me to add a bit more to that.
Sure.
I didn't want to take over. When it comes to things like your resumes, I'm not fussed with what your enter or ATAR or TR, whatever score it's called now, because that doesn't mean anything to me. Put things at the top of your resume, like, as I said, your work experience, and not necessarily just clinical, but customer service. If you speak another language, that's also great, especially around Sydney, Melbourne areas. And if you have a car, also really important. So those are the things I would highlight.
Great, thank you, Jacy. So are there any other things that anyone else looks for? No?
I suppose just a general thing that you can, there's a difference between being quite appropriately friendly and polite versus being overly familiar. Obviously, just the very basics of dressing appropriately and having, you know, it does surprise me sometimes when you ask at interview, why do you think you're the best applicant for the role? You haven't prepared an answer to the most obvious question. So there are some fairly basic questions that will always be asked in an interview, such as, you know, when you've been in this or that difficult situation, how did you handle it? So having some prepared idea of those customer relations situations that you've been in, either as a student placement or in your high school or student jobs, actually is a really good idea. You should be able to preempt some of the interview questions and have a little bit of an idea of what's going to happen, so that you can actually, and you modify it on the spot, obviously. Thanks.
Yeah, thank you, Kate. That's really great advice. So now the next question would be sort of, again, for those in manager roles. How did you progress from an audiologist to a manager, and sort of what advice would you give to students heading down that same path or looking to head down that same path?
Okay, so I went down the training kind of path rather than managing clinics. I just think it's important to always put your hand up, you know, offer to supervise students is a great way to sort of start, such as yourselves at the moment, and that can move into training roles, asking if you can shadow managers and opportunities to work on projects, making sure that you know what's there and what's around. I do find people generally go into, in my area of work, they go either the managing clinic path or the training manager path. So it's just sort of keeping your eyes and ears open and asking for opportunities as they arise.
I think also having extended your training beyond your basics. So often you might, obviously not for the first few years of your working life, but you might want to look at doing PhDs or look at doing Masters of Public Health or look at doing MBAs if your idea one day is to progress through different layers of the organisation that you go into. Having that extra string to your bow is going to help a little bit.
Yeah, great. Does anyone want to add anything on to that?
Yeah, I agree with what Jacy was saying. You sort of just need to be confident to ask questions and confident to ask for training if you're finding that you're being drawn to something or being passionate about a certain area. The way I sort of went about it was, once I was sort of getting to a really confident clinical point, I sort of started asking to sit in on things with who my manager was at the time, asking if there was any extra tasks I could take on, if I could learn more about a certain area within our department. Similar to what Jacy said, also I started putting my hand up for projects when they were offered to staff within our organisation. People get to know your skill set a little bit better, what you can do. They might see potential in you that you don't know is there yourself. And then also, I would really advise, don't get complacent in your role. It's so easy to just get into work and think, oh, you know, let's say you become a rehab clinician. I'll go in, go to work every day, see the clients, leave work. I would advise to be a passionate learner. So go out of your way to read updated journal articles, jump on LinkedIn, get yourself a profile. There's so many professionals out there sharing really good content, updated research. Just constantly keep absorbing what's new within the audiology world. And it just opens up a lot more opportunity for you.
I just would like to add something to all what was said already. I'm really grateful that you mentioned the way how you're going up in a chain of your, career. And often students do not quite understand why we're doing any research during our degree. Like they're very eager and keen to get to the clinic and start testing and fitting hearing aids. And I think it is really important. I'm always repeating it to students, like, listen, you don't think about it now. I know you need to get your main skills and so on, but then after a few years of doing your clinical work, you may think about, developing, being, on top of what's new in the profession and doing the research as well. And one of the way which I can hear from people who actually progress in their career is to go to be involved in research projects, maybe doing PhD. So then the skills you're learning now can be very handy in your clinical practice, actually. Thank you.
Yeah, so thank you for all of that. Does anyone else have anything that they'd like to add onto that?
I'll just add to that, Alicia, because that's such a good point. I remember being in that student mindset, and it's so easy just to go to uni and think, God, I'll just do this lecture and leave. But honestly, hindsight is a wonderful thing. Your university lecturers are your biggest asset. Learn as much as you can from them, book times to sit down with them. They're all experts in their field, and it's well worth using them while you've got access to them to learn as much as you can, because I guarantee that moment will hit you when you're in your career and you just think, oh, wish I'd done more.
Yeah, thank you, Liz. So if no one else has anything to add on to that, I noticed Hannah has joined the room. So I'll get Hannah to maybe introduce herself and tell us a little bit about her background as an audiologist.
Thanks, Kayla. I'm sorry for running a little bit late this morning or this afternoon. So my name's Hannah. I'm currently acting in the audiology manager role at Barwon Health, which is located down in Geelong. And my background, I guess I've had a different pathway. I've kind of started in the hearing aid sector. I was working for Zale Hearing Care, which was a private hearing aid company down on the peninsula, on the other peninsula, and did a lot of diagnostic work in that space as well. Worked really closely with quite a few specialist ENTs. And I did that for 2 years. And then I moved across to the Ionia Hospital, where I started to kind of dig into the diagnostics a little bit more and have been working in public health ever since. So I've done 3 years now at Barwon, 5 years at Ionia. So adult diagnostics and vestibular is my specialty, coming from all of that work in that space.
Thank you, Hannah. So I just wanted to ask you, so you mentioned that you moved it from more of a rehab role to a diagnostic role in hospitals. So can you describe for us maybe the differences between the roles that you've had and aspects that you sort of weren't previously aware of, any changing expectations, things like that?
Sure. I think they're all complementary. I think it certainly was an excellent foundation to learn about a lot of different aspects of audiology in the 2 years that I did do with that private hearing aid company, and it was kind of a bit of a 50-50, to be honest. It was a bit of diagnostics with ENT and then the fitting that went alongside that. And I found a newfound respect, I think, for hearing aids and for that component of audiology. But I always knew that my love was with the diagnostic component of that. And I think that transition for me, moving from working with private sector rehab and with diagnostics, I found it's challenging, I think, in a way, but also you become a more well-rounded clinician, I found. And I think I'm still pulling things from that to this day, even though I haven't worked with hearing aids for a very, very long time. I think you know who your connections are. Audiology is such a small little world, and I think we come across so many different people on our own individual journey that are going to mean better patient outcomes as well, because we know who's that next stepping stone for them and how's the best way to access it.
Yep, fantastic. Thank you, Hannah. So I'll pass on to Laura now to ask a few more questions.
Yep, so I've just got a few more individualized questions. This one is for Chun-Yao. We're just wondering what it's like to work in audiology, but in that remote setting.
Yep. So unlike a lot of my cohort, so I'm in Alice Springs at the moment, and with the remote setting here, I'm based at the community health centre half the week, and half the week over at the hospital, the ENT outpatients. So between the two settings, I see mainly pediatrics, but also as well as adult diagnostics as well. And then on top of that, the ABRs and baby ABRs as well.
Yeah.
Additionally to that, we also have our remote bush trips. So we go to the remote communities average once a month. We do have more trips going on, but we have a lot of fly-in audiologists doing those because we are understaffed. So most of the time we are here. So I have 2 supervisors. We share between the caseloads here and share between the bush trips as well. So between those, we have very remote Indigenous communities, urban health, and also as well as the acute health over at the hospital. And so very varied clientele and a lot of ear conditions. No one day is the same as the other day as well.
Yeah, that's good to hear. What would you say that you enjoy the most about your role, and what would you say are your main challenges?
There are a few things I do like. So I do get to try out a lot of things in terms of I kind of get a little bit of taste of like a bit of flavor of audiology here and there. So I get to see different people and also different age groups as well. So in contrast to my friends who are mainly doing adult rehab, I get to kind of explore everything, bits and pieces here and there, and become a bit of like all-rounder. And so I learn skills that many people don't get to learn outside of this environment. But on top of that, that's also a double-edged sword where it is a huge learning curve initially, being understaffed and having to do a lot of things. I've been pretty independent since day one onwards with very minimal supervision. So a lot of things I have to proactively ask for help and not having it hands spoon-fed to me. So that is one of the main challenges in this role. But also on top of that, I do get a lot of the autonomy as well. So that's also one thing I do enjoy. So I'd find my own ground, do things my way instead of trying to copy someone else. But at the same time, I always know there is help when I need it. So my supervisors are always there. So that's one of the things. And also, I think another thing I do enjoy is the great learning opportunity. I've been doing some newborn hearing screening here and there as well, because we haven't had a newborn hearing screeners for 3 months at the start of this year. So some of the times my manager will ask, would I be able to go over to the hospital and cover the maternity ward? So even though it's outside of my career description, it's still something you just put your hand up for and say yes. So I think very similar to what everyone else has said before, just say yes and take up as much opportunity as you can and just learn whenever you can as well. And I think that's one of the things I do enjoy here, that yeah, every day is different.
No, that sounds really interesting. That's really good to know. Thank you.
Yeah, so I think one of the questions in here was asking about what pediatric audiology is like.
Oh yeah, I think someone's asked that.
Yeah, so we do mainly do pediatrics here because we do have a children's development team in the building. So they are mainly with the speech physio and OTs. And then we do get a lot of referrals from that team for audio. So a lot of our patients are children, urban and remote as well. And so the challenges managing parent interaction. I think one of the main challenges are with the remote clients. With the Indigenous parents, they have a different priority to health compared to the general population. So a lot of times the difficult part is bringing them in for their appointments because they do live out bush. And so a lot of times I don't see the importance of ear health and hearing in general. So that's also trying to communicate the importance of health to them with picture cards and what we call a talking culture. So we have a team of speech pathologists who write up or who design these cards that we use to help communicate with them so they can visually see the importance of ear health and very early development for the children. So that's one of the main challenges with the parents. With urban parents, I think it's not as much of a challenge because they do bring the kids in. Usually they have concerns of their own. So they know that it's something important to themselves, or it could be a school referral. So usually with the parents there, it's not that difficult to sort of interact with, if that makes sense.
Thank you for that insight. That was really in depth. Thank you.
Yeah, you're welcome.
Our next question's for Alicia. So what led you to your decision to move from being an audiologist into more of an academic role?
Yeah, interesting question. I really did like the work of audiologist. However, after a few years of doing it, I started to have more questions that answers I could provide, and they were related to situations when you had two clients with similar hearing losses. One would benefit well from hearing aids, the second one wouldn't. And the answers to this were very limited. And I think I started having more questions and lean more towards really researching what we do rather than just do things. And I think that pushed me towards doing my research degree, my PhD. Also during my master's, I was lucky to be on a scholarship at Cambridge University, and they used to have the best hearing lab in the world, research lab. So as a master's student, I get the opportunity to work for a very short time, for 3 months. I was a student exchange in their lab, and kind of had the sense of this kind of research back in me. So I think that's probably something what happened. Like I love the job, and I still, when I'm teaching students, I'm benefiting from what I learned actually sitting with the clients. But I think I was kind of more interested in research side of things.
No, that's actually really interesting. Thank you. Is there any advice that you would give to students who are considering going through and doing a PhD in the future?
Yeah, just do it. But so what I want to tell you is it's interesting because you wouldn't believe, but while working with students on research projects, I really, really do love it. I love working with my students on research projects, but I can very accurate say, in a very accurate way, who will be back in a few years to inquire about PhD, because you can see it's just this kind of this nature. When you really want to ask questions, you ask the right questions. And I'm always joking with this. So when you are back and at the end of the project, like, never, I'm writing this master thesis, that's it, I'm never going to write anything. Well, it's not the truth very often. So after 2 years usually, or 3 years, they just started kind of inquiring, and we're always very, very very happy to welcome our students back. So Liz, if you're ever thinking about anyway, no, but the advice is do it, and I think you will feel it. You will feel it in your blood. You are eligible to do the PhD. So if there are any questions regarding eligibility or how to get into PhD, I'm very happy to answer them. But absolutely, just go for it.
No worries, thank you. There's just a couple more questions from me, but these ones are directed towards Kate. So the first question is, what was it like working in a private practice, but also overseas?
Yes, so I worked in Singapore many years ago, and because I'd worked in Melbourne, Sydney, which is temperate climate, it was just quite amusing the difference the humidity had on funny little factors like your soundproof booth getting moisture in it, and just things that I wouldn't have predicted. I think anyone working in Darwin probably has similar issues in terms of also we used to, with the hearing aids, just getting them, a lot of those moisture problems that used to happen. So that was just interesting that the climate itself led to different solutions for hearing aids in terms of what you would use. You would never use the soft acrylics in those sort of environments because it was just too sweaty and too difficult for the patients. It was before newborn hearing screening as well, so I did a lot of screening whole classrooms to find that one deaf child that the teachers already knew was a problem, but they had to have that professional help to convince the parents, which was interesting. I think you would have those sort of issues any country in the world, unfortunately, but they were new for me because I was a relatively new graduate over there. Private practice, we did everything. It was a funny sort of setup over there because you didn't sort of say, oh, that's done by the public system. You basically just did whatever came to you. Singapore's definitely a first world country. It's definitely very interesting and diverse and safe and clean and everything, but some of its healthcare issues are very third world in the sense that back then, I don't know about now, but back then you could be walking past people on construction sites with just the piece of cloth over their mouth and nose and throat sort of thing, so, and ears, and so obviously not the same level of workforce OHS compliance that we would have now, and probably it's improved over there. Singapore is obviously, there's a lot of English speakers, and those elderly who don't have the second language often have sons and daughters who can act as an interpreter. So it's a good, it was a good place to go in terms of being able to still work without having the language. Yeah, so hopefully that's easy in a nutshell.
Yeah, no worries. Thank you. Just one more. Can you please tell us a little bit more about your involvement with the Audiology Society and how it's contributed to your career?
Yeah, I think this goes back to what everyone else was saying about putting your hand up to do extra things. So I think that was my way of going, okay, I can put my hand up, I can go find something to put my hand up for and have an extra string to my bow. They're volunteer positions. At the time, it allowed me to influence some of the CPD training that went on. There wasn't a lot of vestibular work at the time. A lot of audiologists into vestibular work at that time. So it kind of was a nice way of me being able to say, can we do some of these more diagnostic CPD things? Obviously, if you wanted to put up your hand to make a suggestion to say, can we do this? You were then told, well, how are you going to do that? And I think that was actually a really positive thing, because if you want something to happen, you've got to actually get on with trying to make that happen yourself and contribute to the profession in that way. I was quite surprised recently to realise that one of the new grads thought that they were paid positions on the ASA committee, and it's definitely a volunteer role. And I think that that's actually a really good thing to have on your CV in some ways, because it does actually show that you're willing to contribute, that you're willing to give the extra mile, and that you're not actually solely interested in transactions that, you know, I do the work and I get paid. It's more, I'm prepared to contribute to the wider community, the wider professional development. And it's also professional colleagues that I met at that stage in my late 20s, early 30s. I'm still in touch with them. Some of them are still in similar level roles now. So it's actually was quite amazing to think that 20 years later it could actually have assisted in terms of collegiate contacts. So yeah, I think it's actually a good string to have to your bow in some ways. Yeah, that's it.
No worries, thank you. I'm going to pass back over to Nasunki now.
So to any of the panelists, what does the graduate journey sort of look like in your current organisation, and would there possibly be any roles for any future students?
I think I caught what you said. Sorry, you are quite soft. I don't know if it's just my speakers. So yes, we do have a graduate program which we would run every year. Obviously in May, it's hard to tell what we'd have for next year, but we actually just did a second round and hired another 7 graduates. So that gives us, I think, 11 or 12 that we hired from last year's group. So the graduate journey, we do our induction. We have our head offices in Port Melbourne. So we usually run it. This year in January, we couldn't run it face-to-face because of borders. So it was a virtual induction, which I'm sure you're all quite used to. But we have quite a structured program. And then it's a gradual introduction into clinic work. So you first say you'd see one client and you'd gradually build that up, and you'd be paired with your supervisor. But we've also got trainers or a performance coach, as we call them, scattered throughout. But I think after last year, like most businesses, we're very good at being able to do a lot virtually. So a lot of our training is now like this. But we do make sure we get out and face-to-face and support our grads to then get UQP after those 12 months.
Add anything to Jacy?
I can speak a little bit about public health and graduate training, if you like. So with our graduates, it is a bit more of an ad hoc process. I guess it does depend quite heavily on when we get funding and kind of staff movement as well. But we certainly do have graduate programs coming through. They're just not at a defined start and finish time. We also have quite a semi-structured approach to graduate training, I guess, as well. It's often introducing them to the workplace setting. So there's a bit of that, but we're also kind of getting the foundations. And at Barwon Health, we do a lot of paediatric and adult diagnostics. So it's getting those key skills up and running. And I can see that someone has popped down in the question box as well about how you kind of move into infant diagnosis and vestibular. And it really is a case-by-case process. It's obviously building the foundation first, and then as you're feeling more confident and as you're ticking the boxes and getting those skills in those key critical areas of interacting, that's that communication, it's taking a really good thorough history, it's linking in with your supervisor really regularly. In addition to doing the CCP supervision, we also have a supervision program within the hospital for all staff members where we link in with a different person and make sure that we're kind of topping up our skills and learning in different areas. And then as meeting regularly with your supervisor, we would start to say, well, I've got an interest in vestibular, or I've got an interest in infants, and kind of staggering that. We do our calendar on a 3-month block system so that we're able to kind of incorporate those interests and those learnings, and even if it just starts as a bit of observation and building from there.
Thank you, Hannah. Anybody else want to add anything? Or
I think building onto that as well with the NT government, because it is also public, it is also based on funding as well. So we cover the top end and central. So I can't speak for top end, but for central, we usually have one position that's the capacity for one position a year. And that would be based on if there is a need for that position. It's not widely advertised. So it's mainly through connections and approaching the company as well. And the structure is very loose. There's no formal intern structure. So it's very personalized at where each person's pace. So for some people can be very independent and can be just be on their own from the get-go, but there can be very still at close elbow supervision for the first weeks or months as well. But there isn't a very structural program compared to other rehab companies like the Bloom and Hearing Australia, if that's what makes sense there. Yeah. Thank
you for that, Chun-Yao. We'll move on to the next question. So for any of the panelists, what are some of the issues and trends that your organization or like the industry is currently facing that you've noticed?
For us, it'll be hearing aids you can buy on the internet. That's probably a big one because people will buy them and then they'll come into one of our clinics and want them adjusted and we don't know anything about it. So that's probably one that's sort of come up more recently for us.
That's really interesting. Just never crossed my mind that people actually buy them online now.
They do, yes.
Anyone else want to add anything to it?
COVID has been ours down in Victoria, is that we've really moved to a telehealth model to basically interact with as many patients as we can. But because we are, for those that don't know, Barwon Health is a big regional hospital, so we're spread over multiple different sites, but we've been really careful with how many people we're bringing into that acute site because it was I guess, identified as somewhere that potentially, if we were to have issues last year, and thankfully that's all under control now, but we were quite conscious of making sure that we didn't have those face-to-face appointments if they were not critical at that point in time. So it's been a real pathway, I guess, to get to telehealth as we've got it at the moment, which is where every new referral that we receive into our service is interacting with an audiologist like this, like we're doing at the moment, and kind of building some rapport and understanding a little bit more about what their requirements are of us in the healthcare setting.
Yeah, I think the industry has really moved on to Zoom and sort of doing everything online now. Because we're sort of running behind, I'll pass it on to Kayla to ask the other questions.
So thanks, Nasanki. So now I'll go through some of the students' questions that were mentioned in the chat. So if any students want to add any more questions, feel free to type them out and I'll get to them. So the first question we have is from Hannah, and it says, do you know if it's possible for hard of hearing people to be an audiologist? So that question's quite general to anyone. So if anyone would like to answer.
Yeah, definitely. I've worked with a number of audiologists who all wear hearing aids. And I find a lot of the time they understand more what their clients are going through, and they can explain different technologies and features from that personalised viewpoint. So yeah, definitely.
I can add to that also. At Expression, 40% of our staff are deaf or hard of hearing. Our speech pathologist is hard of hearing, and we have audiologists that are also hard of hearing, and lots of staff that are deaf and non-oral and use Auslan only. So very diverse workplace.
Yeah, thank you. So the next question is, one of the panelists mentioned that they were debating between audiology and speech path. What made you lean towards audiology in the end? So I think that's directed at Liz. So if you want to tell us a bit more about that, I know you touched on that briefly before.
Yeah, so once I jumped into my degree, I just started doing volunteer work at speech clinics and aud clinics. And I think what it was maybe the more immediate result that you could get from audiology. And that probably just comes down to a personality thing of me, that satisfaction of being able to get someone on their rehab journey maybe quicker, or, you know, more immediate results. Speech pathology and rehab tends to take a lot of time. We still have that as a service available where I work now, and I love working alongside speech pathologists. For some, particularly maybe deaf oral clients, it's a great combination, audiology and speech pathology. But yeah, I think just for me, it was maybe more that the immediate rehab that you can get from audiology as opposed to speechies.
Yeah, absolutely. Thank you, Liz. The next one to Chun-Yao. I think you answered this one before about your typical day as a paediatric audiologist. So if you want to add a little bit more about that, otherwise we can go over it.
No, I don't think there's too much to add on to it. It's just, yeah, it's very varied. We see everything from VRA to play, and then also infant baby ABRs, and then every now and then APD assessments as well. So it could be anything that could be, yeah, we don't expect the same day to be the same. Yeah.
Yeah, absolutely. Thank you. The next one is, although Auslan would enhance communication with patients, is it necessary to be fluent in it? Also, is this considered during recruitment? So if anyone wants to answer that one.
I think it depends where you're applying. For me, no. And because where I work, it's just adult rehab, and we fit hearing aids, so we're not dealing with clients who have more severe, profound losses. I think it's
Yeah. So at Expression, we work heavily in the National Disability Insurance Scheme sector. So lots of clients with severe to profound hearing loss. But no, Auslan is not required at all. At Expression, it's a part of our culture, but you are taught it on the job, and you use it pretty much every day at work if you're employed at Expression. So it's just a part of our workplace.
Yeah, fantastic. The next question is, someone mentioned that they completed their health science degree at La Trobe and then moved to Melbourne Uni to complete their Masters in Audiology. If you don't mind me asking, what made you lean towards completing your Masters at Melbourne Uni?
Yeah, I think that was towards me. So I mainly looked at the contact hours and the placements for the two courses. And I liked the Melbourne Uni because they had a lot more contact hours and they organised their placements for us compared to La Trobe. I don't know about now, but back then on the course, we had to find your own placements. and reach out to people yourself to organize your own placements. And a lot of the content looked like it was online based. So that's kind of those discerning things that why I lean towards Melbourne Uni.
Yeah, absolutely. Thank you, Chun-Yao. The next one is more of a general question, but what is the biggest thing you have learnt throughout your career, and what advice would you give to new graduates to make the most of their internships? So I guess this can go out to the entire panel.
So was it to make the most of this year or to make the most of their internship year?
It said, what advice would you give to new graduates to make the most of the internship? Yeah.
I think before final year students this year, it's a time to really understand where your passion in audiology lies. There are so many different fields, and I mean, adult rehab isn't for everyone. And if that's the case, don't apply for a job with us. Some people it's diagnostics, or it's pediatrics, or it's cochlear. So I think that is hugely important because it's going to make your graduate year far more rewarding. Also, yes, as we've mentioned before, don't be shy to ask as many questions as possible. In your graduate year, don't be afraid to ask the same question 5 times. I would much rather you keep asking. Make sure as well you understand the why, like why are you doing what you're doing? And I think that makes every day far more enjoyable, to make sure that you then can continue on your career path.
Also, if I can add to what was said, remember that you were affected by COVID, and the amount of practice you could have and being actually hands-on was limited. So when you start, working in a clinic, please learn from your senior colleagues. And I think it's probably even more important to reach out to them. Their experience, they have years behind their belts. Just ask and don't be shy. So literally repeating what was said, but I think it's in your cohort, it may be particularly important due to the limitations of COVID during this year.
Yeah, I think just reiterating, it's a really steep learning curve that first 6 months. There's so much to learn, and it is coming off a really unusual year, but also just in a normal year, there's a lot to learn. There's so much to digest, and it's just almost like becoming a human sponge, essentially, and just taking in that information. Everybody is prepared to offer the information to you, particularly in your first year. It's the ideal time to just take in and process and reiterate. I think, like everybody said, just questions is really what we're looking for, and a sign that you're interested and a sign that you're wanting to develop as well.
And I think there's also a bit of a balance between consolidating skills that you've learned and that you really need to hone in and master, versus being a little bit flexible and taking on some new attitudes and ideas around how that might be modified in some way, versus also just being able to stand your ground, I suppose, on then some of the aspects that can't change, or then having a discussion around which bits, what you think is appropriate in terms of modifying what you've learned at uni.
Sorry, I was just going to add, in your final year, just keep your eyes and ears open as to what's out and about in the industry, rather than waiting for employers to come to you. I know a lot of the bigger adult rehab companies do that, but keep your eye on things like Seek, attend these particular forums that you're doing right now. A lot of providers will run, whether or not they become face-to-face again or virtual. Make sure you're a student member of Audiology Australia, and you can see who's advertising what, so you can get an idea of what is available when it comes time to doing interviews and things like that.
I think adding on to that, it's also to not be afraid to just call people up and just ask around, and just be okay with rejection as well. So you could, call up 50 clinics if that's what it takes.
Yeah, so thank you all for that advice. I know as a student, we all appreciate that. So the next question is, how is working in a hospital setting sort of from day to day, and what are the different roles an audiologist can do in a hospital setting? So I guess that goes out to those of you who currently or previously worked in hospital settings.
Jump in. Okay, you go.
Yeah, it's either you or me. Obviously there's a lot of working with the ear, nose and throat clinics, which can be fairly time critical, and a lot of back-to-back audiograms in a fairly short time just to get them through the ENT clinic. A lot of what we do is the diagnostic work in terms of knowing quite a large number of different test techniques and how to apply them, and being fairly succinct in your troubleshooting and getting through the testing without compromising on the patient rapport and treatment. The actual hospital environment, we sometimes testing at bedside on the wards, so some of the patients just aren't mobile enough to get down to a soundproof booth. So that's always a challenge to know spinal precautions and what's safe for you to be doing with that patient, and just making sure that it's safe for you to be working around the head on that patient. Then infection control, obviously, with even before COVID, that's always a challenge because you're sometimes seeing things like drug-resistant TB. So we would have been in full PPE for going into negative ventilated rooms to deal with those sort of patients, because unfortunately a lot of those patients are on ototoxic drugs. So they're trying to both treat them and look after their hearing and such. So there's those type of clinical challenges, which I suppose they're the things I actually really like about the job, because it's just so interesting sort of being in these other healthcare worlds for a bit to see how things are happening. I'll hand to you, Hannah.
I'll top that up in saying that you'll never get bored when you work in a hospital. There's always so much opportunity for growth and development because there's such a range of diagnostic assessments. I think here at Barwon, we've got APD, infants, vestibular, ENT. We've just over the last 18 months kind of developed a paediatric multi-D team approach as well. So we're working quite closely with paediatricians. There's the opportunity to kind of ask questions with the ENTs. We meet with them regularly. You really are opening the door to learn a lot on the ground. And I think there's also, I guess, the benefit of working in a hospital system is that we are supported by teaching and training as well. So there's all other opportunities to do different kind of supervision training, which we don't really get taught through the university degree. But all these skills that we need as a professional, we're quite well supported in that space. I've just come this morning from doing some leadership training and kind of getting and working with other disciplines to learn and to kind of develop my skills based on other people's experiences. So audiology is wide in its own right in terms of cochlear hearing aids diagnostics, but then once you get into a hospital system, there's so many other pathways that you can follow as well. So jobs that you don't even know might exist yet. And I think it's taking opportunities with both hands anytime that's thrown your way. And I think that's frequently, we get circulated a lot of different emails and opportunity, and it's really being able to access that day to day in your clinic.
And I think too, long term, while a lot of audiologists haven't yet taken up the opportunity of going into the project roles and the other management roles within the hospital, it is a very common career pathway for a lot of allied health to go into different management aspects of the hospital. And there are audiologists who do that. So it is something to consider as a long-term career pathway, is starting off as a clinician in the hospital, but you can actually head into the projects and the long-term management aspects of public health. as well as an option.
Fantastic. Thank you both. The next question is for Kate. So what was the process of applying for a job as an audiologist like in Singapore? And is there any type of exam or anything that you must pass before being eligible?
Actually, yeah, it was a long time ago, and it was actually a locum position. So it was just covering for someone who wanted to go home to America, and they had Singapore at that stage. I can't remember the population, however many millions. It had 2 audiologists. So even being without the one out of the 2 audiologists working in 2 different private practices at that time would have been very, very tricky for the whole country. But that wouldn't be the case now. There would be all the big hearing aid companies that are here now, I would imagine, are also in Singapore. And so I would be looking, if I was going down that pathway, I think I'd be looking at what which companies have both Australia and Singapore connections, and then asking those companies, you know, what are the opportunities for heading across and going that way.
Yeah, sorry, I can add to that one in terms of, yeah, a lot of the manufacturers, they all have reps and roles. I know a lot of people who are working in Europe and all those sorts of things. And then companies, I mean, Bloom is global, so we've got people in New Zealand and a lot of other countries. And in my former life in Amplifon, it's an Italian-based company. And their corporate head office is English speaking. So I think your best bet, if you're looking at those sorts of things when fingers crossed the borders open up again, if you wanted to work in a global company, internal moves are probably much easier.
Yeah, so thank you both for that. That was very insightful. So the next question is, are there any places that we can volunteer to work with audiologists as health science students? So I guess that can go to the whole panel.
For us, unfortunately, it's just a little bit difficult because we try and keep those places for the master's students so they can get their hours. Yeah, so I mean, we could probably look at it case by case, but it is more difficult because we try to prioritise those in their final years.
I think what we've seen when students have applied for graduate positions is that quite a few are doing volunteering at the front of the hospital. So places like the INEA or any other health service sometimes take volunteers, and often they are students. And it's just getting, I guess, it's that patient rapport, it's that communication skills, all these soft skills that we develop just day to day that are so transferable to what we do as clinicians as well. And a little bit, it's like it's dipping your toe into the water, into a different space, a different work environment. And I'm not sure of the process of applying for those sorts of roles, but certainly something that I have seen quite a lot of in the past.
Yeah, thank you. The next question is, from my understanding, a lot of the jobs are mainly in adult rehab and diagnostics. And so how do you get into vestibular and newborn diagnostics? Is it something you just fall into or progress to throughout your career? And are there opportunities for graduates to get straight into it?
I can jump in on that one as well, if you like. So they are a more complex assessment that we would do under the hospital, in the hospital department. And I wouldn't be pushing anyone into it on day dot. Certainly, there's a lot, like I mentioned before, there's a lot of other basic skills that we would like to see developed initially before we kind of stretch your wings and kind of push you a little bit further in either one of those spaces. It is a question, I guess, particularly in the first instance, is we wouldn't definitely do both at the one time. It would be pick one and let's concentrate your energy and your focus on that. But that might be something that we would look at perhaps towards the end of your graduate year rather than at the start.
And to add to that, yeah, you need to have some proficiency and some skill set built up in the general area. so that you can make quick judgments once you're heading into the more complex areas. And I think it's more dependent on where you apply for a job. Really, you'll apply for a job that either has that vestibular arm or that neonatal sort of testing arm and neonatal infant testing arm. So yeah.
Particularly because those two areas are quite complex as well, in terms of you really do need to get the devil in the detail with your test technique and with your understanding of pathologies and your understanding of pathways, which just comes with time and understanding the system.
Yeah, absolutely. Just being mindful of time, I know we're nearing 1:15, so if any of the students or panellists need to leave, feel free to at any time from now. Otherwise, if anyone is able to stay, we can go through the rest of the questions, but yeah, so I'll continue. So how has the NDIS affected your roles in audiology, and would you say it's been mostly beneficial? I guess that goes out to anyone working with the NDIS closely in their roles.
Yeah, I can talk a bit to that. So gosh, NDIS has been a whirlwind. It came in suddenly and it possibly wasn't the most seamless established or the most established process, but we are well and truly knee deep in NDIS clients now, so there's no backing out. It's just a little bit different. So the hardest part is probably, to be honest, counselling the client on what they are actually accessible to. So the NDIS process is not quite clear to the client, and then they're sort of coming to you with an established NDIS plan, which is essentially sort of a bucket of funding to sort of be allocated in different areas in order to meet their goals for hearing and communication. So we do a couple of things. We help people onboard onto the NDIS, and then we service them once they have an established plan. So we do things like they can get assistive technology through that. So if there's someone that already had hearing aids and they may be looking to use their funding to get assistive technology like remote microphones or streaming devices, we do assistive tech in home and safety. So we help them set up things like flashing alarms or vibrating alarm clocks to ensure that they have safety in the home. We do a lot of oral rehab. We do things like tinnitus counselling for NDIS clients. We have a tinnitus team at Expression. I think that's probably mainly the bulk of it. So it's just a different process of seeing the client and helping them access their service through their NDIS plans.
Yeah, thank you, Liz. Does anyone have anything they'd like to add on to that? No, that's okay. And so the next question is for Liz. So can you talk more about the role of an audiologist in the deaf community with a severe to profound loss and how it differs from general rehab? And underneath it says, someone else would also like to hear a lot more about this as they're interested in Auslan and being involved in deaf culture and audiology. So if you want to speak a little bit to that.
Yeah, so there's sort of two parts to it. So we see people with severe to profound hearing loss who are oral and may not identify as deaf or a part of the deaf community. These people tend to use hearing aids and more products and assistive technology to help them in their day-to-day life. But we also see a large cohort of people who would identify as culturally deaf and also using hearing aids or assistive technology. And those people are generally non-oral and would use Auslan as their main communication. So we see both those types of clients. We often would have an Auslan interpreter present in those appointments too. And yeah, it's just a very individualized thing for someone that might be severe to profound on how they feel about technology and whether it fits into their lifestyle and their identity. And doesn't really differ too much from a general rehab, say, fitting of hearing aids. There's probably just a lot more assistive technology we fit to a client like that. So a lot more streaming devices. Off the top of my head, I can think of, we've got a couple teachers of the deaf that come see us. So they use a lot of assistive tech in their classroom environment. So it's working with other products. We have some deaf non-oral clients that use their hearing aids in a very basic way, so it can tend to be easier. They might just like it for safety and awareness when they're in particular environments. So it can be a lot less complex in that sense. And yeah, and then so Auslan, lots of our clients use Auslan. All of our staff would have at least a basic level of Auslan, but we often use interpreters just so you're able to focus on being an audiologist, and communication is aided with the use of an interpreter.
Yep, thank you so much for that insight, Liz. So if there are no more questions now, I think we'll just wrap up for today, but the other students and I would really like to thank all of the panelists for being involved today. I know it's a great insight and we really appreciate your time, so thank you very much for that. And if no one has any other questions or anything else they'd like to speak about, I guess we can wrap up for today. So thank you again.
Thank you.
Yeah,
Thank you.
Oh, thanks.
Good luck with everything.
Thank you.
The panelists. Oh, so I'm gone. I just wanted to thank you on behalf of our audiology team to all the panelists who spend the time with our students. We as a team, audiology team, really do appreciate your input into our program and everything what you do for us and for our students. Thank you so much for that.
My pleasure. Thank you. Thanks for having me.